Hello and welcome to Single Pair Radio. I'm Paul Hoppy, broadcasting from the Hayburn Building in Louisville on the WFMP 106.5 Forward Radio Community Network, where news, information, and entertainment is available 24 hours a day, 7 days a week. The views and opinions expressed on our show are those of the speakers and not the station. We broadcast our programs at 2 p.m. Monday, 7 a.m. Tuesday, and 11 a.m. on Wednesday. We also stream our shows on SoundCloud, Apple Podcasts, and others so you can listen anytime. And remember, this is an all volunteer radio station and relies on your ideas and donations to keep us on the air. Today I'm joined by Kay Tillow, Chairperson of Kentuckians for Single Payer Healthcare, of which I am also a member. Kate will present our program and brings a special guest that I will let her introduce. So let's get started. Kay?
Hello, my name is Kay Tillow. I'm with Kentuckians for Single Payer Healthcare, and you're listening to Single Payer Radio. This program is brought to you by our organization, which is working to educate and advocate for a national single payer healthcare plan, one that would remove the profit from our healthcare system and therefore save the money to provide care for all of our people without copays and deductibles, removing the barriers to care. It's an improved Medicare for all, and we are working to enact that into law, and we hope to do that. I'm joined today by a special guest, Dare Cima, who is a resident of Louisville, but she comes from the Appalachian region. And that is important for us because we are looking into the problems of rural healthcare. That's one of the problems that we want to solve with a single payer system. So Dare Cima is a native of Corbin, is that correct?
Yeah, around that area, I lived all in that little tri-county area in southeastern Kentucky.
And what are those counties in
It
southeast
was
Kentucky?
Knox County, Laurel County, and Whitley County.
Uh-huh. Well,
Some people call it Laurel, but
that's a rural area. How many people
Mhm.
live in Corbin?
Corbin, I think the last time I remember checking, there's about 7,000 people that live there. I lived most of my time at my grandmother's in an area called Girdler, or Heydrich is another area close to Barberville. And both of those areas have about like maybe 1,500, 1,600 people. So very
Uh-huh.
small communities in southeastern Kentucky.
Okay, so could you tell us something of what healthcare access is like in your region?
Yeah. So right now from there's in Barberville there is a Appalachian Regional Hospital there. That is the only hospital in that area. There's an Appalachian Regional Hospital where hospitals that were founded by the United Mine Workers.
Right.
Um, and at Barberville, there used to be the Knox County Hospital there. That in the 90s got bought by the Appalachian Regional Hospital whenever that hospital was going under. Um, but that one is slated to close because of these Medicaid medical cuts and the one big beautiful bill, as he calls it. But it's still like it's not a great hospital. It doesn't receive a lot of funding as it is. Most people, even whenever they live in that area, they'd rather just drive to Corbin at the Baptist Health there, which is about like a 25 minute drive from where my grandmother lived and from Barberville. Maybe 15 if you're speeding a little bit. But and then outside of that, the closest hospital there would be in London, Kentucky, at the St. Joseph Hospital. That Baptist Health in Corbin is also slated to close. And so my grandmother, who lives in Girdler, would have to drive about 35 minutes. God forbid she was ever get into like an accident or have a health complication. She would have to drive about 35 minutes to get to the nearest like actual emergency room.
So with the Corbin Hospital and the Barberville Hospital are on the list, slated to be closed. Is that correct?
Yes. Yeah.
I think that we saw last June when they passed the Budget Reconciliation Act, HR 1, or the One Big Beautiful Bill, or the One Big Ugly Bill, whichever it was, that Senator Markey from Massachusetts put out a letter saying that these cuts that were within that bill were going to cause great harm to rural hospitals in particular. And he put out a list of 338 hospitals that would be in danger of closing because of those cuts. And 35 of them are in Kentucky.
Yeah.
And it's among those that are the ones in Barberville and in Corbin. Is that right?
There's one in Pineville as well, which is about probably another 15 minutes from Barberville there's the Highway 25E that goes all along that way towards Hazard and Harlan in Harlan County. And that one in Pineville has already closed. Probably the one in Barberville is next, I think. Corbin will last a little bit longer, I think, because it's a Baptist Health and it's a for-profit hospital, but it still, receives a bit. Most of its funding is still going to be coming from a lot of Medicaid and government funding, because hospitals can't really make a profit in an area with a population the size of Corbin, and so it is a necessity for these things to be funded by government or receive government some funding. The same way with we need post offices in Eastern Kentucky, because these are services provided by the government at no cost, because the people need them. And so.
Right.
Yeah.
And you come from a family that was engaged in coal mining?
My grandfather, he grew up in Logan, West Virginia. And then he started working as a coal miner at 21. He was always a union miner, even whenever eventually he went and worked as a federal mine inspector. They also had a union, but he was always a union mine worker. He got drafted into Vietnam, came back, got skin cancer from Agent Orange, and then went back to mining in Southern Ohio as a United Mine worker. Where there whenever he was there was some a rooftop boulder thing that he's described to me, where he was trying to pull off the ceiling for some reason, and it fell on him and got hit 2 of his fingers, and so he lost 2 of his fingers doing that, but because of his years of experience in mine work, he was able to get a job as a federal mine inspector, as just a guy who would go in and look at what's happening, see if it's up to code or whatever. So,
well, that area, it was not a place in Appalachia where somebody thought that we should build all these hospitals, and it was left to the mine workers union to use their funds to build the Appalachian Regional Hospitals, or they were the UMWA hospitals back at that time. And now those hospitals are owned by the Appalachian Regional Hospital chain. And I looked at it, it said that 9 of the 14 are on the list that is slated to be closed.
Yeah.
Which is, that would devastate the region.
Yeah, that is almost like every one of those, I've seen the map of it, or where those hospitals are. There's barely any, if any, there's barely any hospitals around them. It's usually just that Appalachian Regional Hospital that's their closest actual hospital they could go to. And so there's going to be areas over there where it's going to be 45 minutes to be able to get to any sort of actual hospital, or if they have to get flown out to Lexington at the Baptist Hospital there, which happens a lot even in Corbin. But those helicopter rides cost thousands of dollars. Ambulance rides also cost thousands of dollars. And if you're in an emergency and they call an ambulance to get to you and you're 45 minutes away from the hospital, you're going to be waiting, almost 2 hours just to be able to get actual medical care. And so this is an area of the country that is already has been horrifically abandoned by the government, and has not received any funding for 30 years after the mine started closing in the 90s. And so like it's already people who are impoverished, who already don't have good health outcomes as is, going to have worse outcomes because they will not be able to get the actual care that they need.
Mm-hmm.
And it's just like it's pretty bleak. It's pretty bad. It's pretty gross.
So even before we were facing these current cuts, it wasn't like these hospitals were thriving. Is that correct?
Yeah, the Barberville Regional Hospital, even whenever I was a kid, I remember people always like, yeah, I'd rather just drive to Corbin. Like that it's just it's always been seen as an area that doesn't have the best care. I think like we've never funded healthcare great in this country. Like even with these Medicaid cuts and ACA subsidies going away, like these hospitals have never received actual proper funding from the U.S. government. This has never been a priority. We've always been, giving more money to the military to go do horrific actions overseas. These have never been priorities of the U.S. government.
Right. So even if we restored those cuts that haven't happened yet, those Medicaid cuts are still in the future.
Yeah.
And which makes it worse. But already the hospitals are suffering from a lack of funding that would give the highest quality care.
Yeah, where this would be like, even if we were to go back to normal is still not great. Like it's still like it's like it's like it is like a band-aid, but it's kind of like a band-aid on a shotgun wound, really. Like it's still been pretty bad. Like it's not been great.
Okay, well let's talk a little bit about why it is that it's not good enough to just restore the Medicaid cuts. We're for that. We're for restoring those cuts. We're for, restoring the subsidies. But quite frankly, that's not going to do it. These hospitals need a steady source of funding, a steady ability to hire the healthcare professionals that are needed in the region. And that's what would be provided with an improved Medicare for all, a national single payer plan. Such a plan involves, and we have there are a couple in the, one's in the Senate, one is in the House now, and they're not perfect bills, but at least what both of them do is that they establish a global budgeting for hospitals. Where hospitals are needed by people in the region, they are funded. The operating costs of those hospitals are funded so that we could begin to bring them up to a higher standard, which is what we need to do all along. And, other countries do that. I mean, other countries have rural areas. It's not like everybody has to live in New York or Chicago or LA, and we need to be able to provide that care, and we could do it. And really, short of single payer, it's not going to really be reversed, the crisis that we face. So that's why we're working to reach the rural areas with the message that if you want to save your hospital, join with us in the campaign to enact a national single payer plan. And interestingly, the 35 hospitals in Kentucky are in congressional districts. 35 hospitals at risk of closing are in the congressional districts of congresspeople who do not support yet national single payer plan. And people, we want to bring to people that knowledge. Hal Rogers is a congressman in East Kentucky.
I know him well.
Do you? How do you know Hal Rogers?
Well, I just heard stories from my grandparents, because he's been in there for forever at this point, ever since I've been alive, at least. And they do not have a good opinion of him, and I don't either. He's not great.
Well, I don't know about what else he does, but he has not joined in the effort to pass single-payer healthcare. And in his region, 16 of the hospitals that are slated to close are there. And it would seem to me that he owes it to the people of his region to sign on to an improved Medicare for all and to work to gain the operating costs to maintain those hospitals. That's the biggest part. You know, there are also a number of these hospitals in Brett Guthrie and Tom Massey and Andy Barr and Jamie Comer. They all have a number of hospitals and they need to sign on to that. It's not just the healthcare, right, that happens to a town when the hospital closes. Are you familiar with what might happen in a town other than the healthcare?
Yeah, I mean, so areas like that, most jobs kind of, because of like deindustrialization since the 90s and also the leaving of like the coal industry, whenever it's not just like whenever hospitals close, like most jobs since then have become like if you were to get a career, the best career you could probably get in that area is either becoming a teacher or working on hospitals, because most manufacturing doesn't really exist there, or it used to exist and it's all left. And so the careers you would want to you would push for is going towards to be a doctor or a teacher. But when hospitals close, that means there's job loss, and that means people have to find other hospitals to go and work at, which means they'll probably end up leaving. But also, those hospitals still don't pay well, and so people are not really coming to work at those hospitals as is, unless we would provide, a better pay for those doctors, better pay for those nurses, better funding for those hospitals to be able to pay for them. These are also areas that have seen just a lot of job layoffs from manufacturing industries there. In Barberville, I think whenever I messaged you about this and emailed you, I talked about how my father used to work at this place called Truehill in Barberville. And Truehill was this like rubber plant that made rubber, and it was very hazardous material there. I remember my dad going on strike there whenever I was like 8 or 9. I know a couple of years later that plant ended up closing because there's another union strike. But that plant, that Truehill plant, is literally right across the street from the Appalachian Regional Hospital. They're like right next to each other. That Truehill plant closed maybe in like 2011, when I was like 10. And now I get set empty for probably like 14 years. And now it's one of those like pallet store gambling things where you go and you spend like $200 on this pallet store and hope you get something out of it or whatever, and then sell it on eBay. And like that's what that place became.
And did that plant pollute the area or cause health problems?
I think a little. I think a little bit. I remember there are these giant, like these big little like industrial towers that would shoot out a little bit of soot and things. And so like it's this is an area that's already. It's one of the most beautiful places that I've ever been to, like in the country. Like it is. Appalachia is one of the most beautiful places that like nowhere else in America looks like it. But we've done horrifically bad things to that environment through like coal mining and mountaintop removal, and just putting polluting industries there, because there's not a lot of people there. So like, well, we can just put it there; it'll be fine. It won't affect that many people. But
and there's a proud history of people organizing and struggling to for a better life in in the mine workers union and in other ways. I mean, there are big community efforts to stop the destruction of the mountains and of the homes and all of the things that were done by what's it called, the broad form deed.
Yeah, something like that. Yeah.
Yeah, well, that gave the companies rights to the land under the houses, and therefore they could do anything that brought the houses down. So it's a long history, but it is an area where people have a heritage of fighting back and working to make things better. And I think that it's possible that we could get something started around the idea that we want to protect and improve our hospitals with an improved Medicare for all. What do you think? Is that possible?
I think it's possible. I mean, there was the teacher strike in 2019 that happened. Like that people are still fighting and struggling like in this area for working class and for improved living. Like it didn't stop happening after the 90s. It didn't stop happening after the mine wars and 100 years ago. Like this is still an area that has been continuing to fight for workers' rights and for a better life for their family. And I think people there will start to recognize when these hospitals are closing, hopefully beforehand, that this will affect like all of them. And start, the idea is that we need to be pushing for them to understand, help them understand, that as we understand that, the only way that we can actually solve this and fix this is through a universal healthcare program or a single payer healthcare program. And I think a lot of people are coming to find that and to understand that. I think Medicare for all, whenever Bernie Sanders ran on in 2016 and 2020, has pushed that into a lot of people's minds. It's like a concept that we can push forward towards, and especially after seeing these recent rises and left-wing populism and progressivism in the past couple of years. I think people are more open to it than ever. It's just finding people who will fight for it in Congress, or finding people in rural areas who are organized to fight for this idea.
And many people don't know about it because the media does not carry our message.
No.
It's interesting that the media covers everything from the center to the far right. So that many people are not even aware that there is legislation that could fix this, and that they're not aware of the situation that our country spends about twice what other wealthy nations spend per capita, and we have worse outcomes. We are 49th in life expectancy, and very low in terms of infant mortality. We're not good on caring for our babies. Maternal mortality is even worse. And we spend much more money, something in the area of $13,000 to $15,000 per person in the country. And we're not getting our money's worth. And that's why we can't just throw more money at the problem and just say, okay, well, let's just put a few billion more, a few trillion more, it's in the trillions, into the system. We have to take out the waste that is caused by the profit makers. And that really is the problem.
It would also I remember seeing there was a study, a long-term study done on it a couple of years ago that I remember coming out talking about how Bernie Sanders Medicare for All program would actually save us money over time, because of all the U.S. government money over time, because they keep a lot of this money ends up just going to health insurance, health insurance providers, or drug companies, for-profit drug companies. And if we had a universal program that would cover everyone, that just provided the service itself, it would save us money. There's no really economic argument for why they wouldn't have a universal healthcare program, outside the fact that there's healthcare lobbyists who want that money, and a lot of those people are bought off, and so
so it really and people have to understand that it is the profit. We have a situation where the mainstream media and many of the other institutions in our society reflect the thinking of the insurance industry. And so it's many academic institutions are promoting policies that say we just patch up the Affordable Care Act and throw a little more money into it, and no problem, we'll have it all fixed. And as that continues, we have the structural things that are awful. For instance, who would design a system where the company gets more money if they deny the care?
Yeah.
And allows a private company to do that. And yet we have that with something called prior authorization, where the physician can say, we need this test in order to do the diagnosis. And the company can say, well, we think you don't. And we're denying that. You know, that's the battle every day. People in Medicare Advantage programs, which is one of the problems that the rural system has, is that Medicare Advantage is the privatized Medicare, you know.
Yeah, I see billboards for that all over, like all over Louisville. When I drive home to go see my grandmother for like holidays, or whenever I have a free time to go see her, there's billboards all throughout Southeastern Kentucky of asking people to switch to Medicare Advantage plans, and pushing for it, and saying that it's better provided health care when it's not. But they will push for this for-profit option, but they will never push for a better non-profitable better solution to help actually provide care for everyone.
But and the Medicare Advantage has been gaining ground. It's over half of Medicare is now in the Medicare Advantage plans, but it's not because it's better. It's because it is cheaper on a monthly basis. So if you're living with a limited income, which almost all of our seniors are, huge numbers are, then you may be forced to go into Medicare Advantage in order to just sustain yourself on a monthly basis. And that's not right. I mean, that's not, that's not fair. And then the Medicare Advantage makes deals with the hospitals to pay them less. And so they are decreasing the funds available to the rural hospitals. I spoke with a physician in Holly Springs, Mississippi, who told me that, he's trying to maintain a rural hospital there. And he said that the Medicare Advantage plans are about to do the hospital in because they can't sustain themselves on these lowered levels of payment. And that's what those plans do. So it's, that's in an African-American community in Mississippi. So this isn't just Appalachia, it's everywhere in the rural areas of our country where people need care. One of the other things that's happening is they're closing down the labor and delivery and the cardiac care and sometimes the inpatient unit. Are you familiar with that? Has that happened?
I've heard. I mean, I've heard about this. I'm not sure or aware if this has happened. I mean, the Appalachian Regional Hospital in Barville, I don't think has ever had like a lot of the good provided of those types of things. They have a little bit more inpatient stuff, and they have like kind of an emergency room. But any major operation that needs to be done, like they're immediately getting took to Corbin, or they're immediately getting took to London, or they're immediately being flown out to Lexington. And so it is like, a subsistent care. Like that is all it is. It is just like the bare minimum service they can provide. And it's not great. It's not great.
Not great, but we have to sustain care there and improve it. And that's really what this battle is about, to make sure that every human being has a right to the care that we know how to give. And, in our country, we have the ability to have a really great system. We have a lot of wealth. We have a lot of doctors. We could have more. One of the things about a single payer system is that if physicians are on the staff of a hospital, they are also provided for in the global budgeting, which means that single payer healthcare, Medicare for all, could provide a way not only to sustain the hospital, but to sustain the physician practices in the region as well. Because, I don't know how hard it is to find a physician in Appalachia, but it probably isn't very easy.
No.
For some people. And, we could make that a lot better. We could, with a single payer plan that would budget for those physicians in the meantime.
Mm-hmm. A lot of people think that we could Medicare for all would just because people have not really experienced proper and actual healthcare in this country. I think a lot of people are worried that they hear government assistance, and especially in Appalachia, they hear government assistance and they get really scared about it. They get very uncomfortable about it. I think there's that joke that's it's people being okay, well, when the government shows up, that's when it's bad, or you don't want to hear we're the government, we're here to help. People don't like that there, but a universal program won't just cover bare minimum subsistence, just keeping things a little bit afloat like we're doing right now. You could provide, and we can provide, actual sustained proper care and improved care. There's no reason in our country, which is what I've heard is the wealthiest on earth, shouldn't be able to. There's no way it shouldn't be able to provide the best care possible. If we were to try and fund actual proper healthcare and get the good doctors that we needed, it just doesn't make sense to me.
And then they say, well, that would cost too much, but the reality is it costs less.
Yeah, it saves us money. It saves the government money too.
It saves the people money. It saves the government money. And, that's what's wrong with our system, is that it's founded on the idea that people are overusing the system. So the people that wrote the Affordable Care Act wrote into it that, you could raise deductibles and copays and all of those things, so that we're trying to squeeze out the unnecessary care. The reality is there is very little unnecessary care. There's some, but there's more people with no care or a lack of care because of the money. And those figures are now huge. I think we now have 100 million people who have medical debt.
It is the leading cause of personal bankruptcy in this country.
That is amazing.
Yeah, it is the number one leading cause of personal bankruptcy. It is the number one thing that people fundraise for on GoFundMe. It's medical expenses. It is there's no other country also with OECD nation or whatever, or first world nation as people call them, has this issue. Medical debt is not really a word that exists in France or even England with their national healthcare system that is being privatized at the moment. But these are not words that exist anywhere else except for here. And so it is crazy that it exists.
Yes, and of course what that means is that people limit their own care because of that. It's not just that, if you go to the emergency room, yes, you can get care. If it's an emergency, there are some hospitals that will decide it's not an emergency and turn you away. But we do have a law that we fought for called EMTALA, Emergency Medical Emergency Active Labor or something, that says if you arrive at the hospital and you're in dire need and your life is in danger, they have to treat you. But that's the only place in our country. But still, you will get the bill if your insurance does not cover that, or if you don't have insurance. And that bill will deter people from going again. Yeah.
People always will bring up, when we talk about universal health care, their counter argument is always, well, what about wait lines? There's always going to be wait lines. You're going to have to wait. You're going to have to wait to receive care in other countries. It's people have to wait to receive care too. They just can't. If they have an issue, if they have an issue in Canada, they will just go to the doctor and they'll be like, here, we can treat you today, or you can come back in a week or two. People are worried about, like, well, they'll say, well, what if I have cancer and have to wait to get treatment? It's like, yeah, everyone in this country waits to get treatment if they have cancer because they're worried about being able to afford the medical bill. Or even then, that's not true about Canada. If you have cancer, it's like, oh yeah, we got to get this treated today, and they'll schedule an appointment to go and do it. It is, people are already not trying to go to the hospital in this country, or taking up the necessary resources that people say, or overusing the doctor or whatever, because they cannot afford to go to the doctor. People are already waiting to be treated. And also, like, I don't think I care if people are going to the doctor that often. People should be going to the doctor as often as they need to if they are worried about it. Like, I don't think people are going to be, they're like, well, what if they're just going to be going to the doctor all the time? It's like, okay, good, cool. They might be treated for something for once. Why do I just don't, I don't think that's a good counter argument against our point that, oh no, people can receive healthcare. That's crazy.
Yeah, we've looked at some of the figures on that, because there are people that say, oh, our system is so expensive because people use it too much. They go to the doctor, they go to the hospital. If you compare hospital visits annually in this country and, say, Japan or other countries, we go far less than they do, and we have many fewer inpatient days in the hospitals, which means that can't be the reason it costs so much.
Yeah, there might be something else. It's crazy.
And well, if you just look between traditional Medicare, which is publicly funded, operates on about a 2% overhead for administration. And the Medicare Advantage plans in the area of 15%. So, we're paying a lot more, and all of that money's not going into care. It's going into the profit and the procedures that they use in order to make the profit. All of that, denial and utilization review, and they put restrictions on the doctors as to how long they can spend with the patients. And, that's another thing that's been happening, is that we used to have physicians were practicing mostly as independent professionals with private practice. Those practices are being bought up by private equity, by hospitals, and by other kinds of insurance companies. And then the doctors no longer are free to exercise their professional opinion as they were before, which is limiting our ability to get more people going in to be physicians. So it's that's a piece of the battle,
people are not going to be receiving the proper care they want, because the physician might not be able to, like, recommend that person the actual care that they need, because it's not in their network, or the hospital that they're at will not doesn't provide that service, because I think it's too expensive for them to provide that service.
Yeah, that's one of the beautiful things about Medicare for All, is that the whole country is in the network. The whole country, all of the doctors, all of the hospitals, everything is within the network, so that you have the ability to actually choose your physician. They talk like, oh, when you get Medicare for All, you won't be able to choose your insurance company. Who wants to choose between Humana and Cigna and Aetna? Which one can rip you off the most?
They don't act like, oh, you have the choice to choose which doctor you want to go to and make an informed decision about what doctor you want to go to. It's like, no, you get to choose what health insurance provider you get to have. Like, wow,
right. That's
awesome.
Right. That's where we get to choose, and that's really no choice at all, because they all act within the same kinds of restraints, and getting worse. I'm really concerned about AI as they bring that into.
They use it for instead of a person overviewing whatever the physician is sending to him, or the health insurance provider is sending to him, or the physician is sending to him, or the doctor is sending to him, being like, hey, I think we need to get this person this type of care, instead of having a human being read over the physician report or anything to see if we actually can provide it. They're just having AI just automatically deny claims, and there's no actual human oversight over it. And AI is famously not good at reading and overviewing things like that. And whatever the person who has programmed the large language model or the AI to do, like if the programmer wants them to deny a certain type of care, it will just do that. Like it's not making intelligence is kind of a lie here with the artificial intelligence. It's not making an intelligent or informed decision to deny that person like actual care. It's just whatever the person has programmed the AI to do, and to deny that care, it will do.
Yes. Yes. So technology, in the hands of private corporations always turns bad.
Yeah, it's interesting. There's been a few movies about that, I think.
Yeah,
In the
what are the
80s, I believe.
movies?
There's a movie called Terminator that might be about
I
that.
see.
There a couple other sci-fi movies.
Yeah, because we see that in healthcare. There's always these conferences that talk about hospital at home and telehealth and all those things. And I'm sure that telehealth can be helpful, that people can speak with a medical professional long distance, but to substitute it for human beings, we see places where the person is at home and they connect them to the machinery and collect the money, and there's no humanity there at all.
It's crazy to spend, like, if you're an uninsured person, to spend like $300 on a physician appointment, and then it's just over the phone. Like that's like you didn't leave your home, and it costs you $300. Like it doesn't make sense.
Right. So, technology without the humanity and without the oversight by something that is geared around the public good rather than the private interest. And that really is our problem, is that it's their profit-making industry, and they say they're going to keep it that way. And some people say, well, we can't change because that would be too big a disruption. What do you think about that?
I might disagree with them about it. I do think that universal healthcare is a popular, like it polls, like every time there's been a poll done on Medicare for All, universal healthcare, it always polls in like the 70%. Like this is not an unpopular issue as is. And even anecdotally, I can talk about how during COVID we had that COVID Medicaid like insurance, like temporary coverage that it lasted for like a year or so. That I remember like a lot of my family getting on. That provided healthcare at no cost. You could go to the doctor for whatever you needed. There was zero copay, zero deductible, all of that. People were just going to the hospital and getting treatment for things that they wanted. And my father, who was a bit more of conservative than he used to be, he was one of those two-time Obama voters to Trump voters that happened. Where even then he was like, yeah, this COVID Medicaid's great. I went to the doctor. I took my family to the doctor several times that I didn't, that I couldn't do before. I was getting coverage, like it was popular. Everyone was talking about it. They're like, how awesome this thing is. And people do like universal health care when they got it. I remember there was a clip of mayoral candidate Curtis Sliwa in New York City who ran for mayor, who was in England a couple of years ago, where he was talking to a reporter about how he got a broken leg, or no, he was stabbed, and he went to get a treatment for his stabbing. And he was talking about, it was like after the thing, he was like, "Oh, do I have to pay a bill or anything?" And they're like, "No, it's just free." I'm like, "All right, cool." Where here it would probably be like $20,000, maybe $30,000 or something like that, and there it was free. But even people who use them, they like it when they got it, and so
Uh-huh.
Yeah.
So why is it that with this vast majority support over decades
Mhm.
for improved Medicare for all, that it doesn't happen?
So I think it is just like politicians in this country are always of a certain economic like demographic of people. It is people who are making $200,000 a year. It's always professionals or business owners, local politics, and in national politics. Like it's never working class people who are getting elected to these positions, mostly because they can't afford to run for office. And so these politicians are of the same class of people who are making the decisions for healthcare insurers, or these for-profit businesses they used to run, and they run in the same circles, and they see themselves in each other. That and also these people are paying them money to give them it's like we'll help you win this election. If they have millions of dollars they can throw at elections to get people to not uh, um get people to not be in favor of universal health care. You see this with the oil lobby. You see you see it with anti-Israel stuff. You see it with a lot of these things. Is that all these private businesses and large corporations have the money to be able to buy off politicians, and it's been like that for a while. It's been that for years, even before Citizens United. I think it's always been kind of like this, where
So some way we have to raise the level of our demand
yeah,
to equal the catastrophic
yeah,
conditions that we face. And
yeah,
it's not enough to say, oh, I'm for healthcare. I'm going to bring these 3 drugs into a better price range.
yeah,
That's the kind of, we're getting little tiny
mhm.
things as proposals. Well, we'll restore some of this Medicaid, which was never enough as it was.
Yeah, or like this means tested nonsense to provide maybe we'll provide healthcare for college age, postgraduate college age people who opened a business for 5 years in a low income areas. We'll provide you healthcare and assistance or something like that, like things like that. Or over time, where like what will happen is, and this is my worry with these Medicaid cuts and these ACA subsidies is that over time, these things will be cut, and then 4 years down the line, or even in this next coming election, people are going to be like, yeah, we're just going to get back to there. We're not making any more demand past that for a better future, or even a better outcome, where it's like, we'll just need to go back to what it was 4 years ago, and they'll be fine. You saw this was tax cuts that kept happening. The Republicans will pass, and then Democrats will get elected and be like, we just need to go back to those tax cuts. Everything always happens like this. It's where we have to go back to paying for the bare minimum subsistence stuff after it gets cut over and over and over and over again. But things like Social Security and Medicaid, until about recently, were not things that people would touch because they saw it as a third rail in politics. And in England, it's the same thing with their national healthcare service, where like even arch conservatives like Boris Johnson, I remember in 2018 when he was running for the Conservative Party there, like even they don't want to talk about doing cuts to national healthcare service. Like they'll run on being pro national healthcare service, but then they'll end up cutting it anyways. But still, like it's these things are wildly popular there. All these social democratic reforms are always very popular, and people don't want to cut them because of how like it is like it would cost them an election.
Right.
And I think what we have to do is like people always talk about being organized, but like the working class people need to be more organized to push for our politics that we need to make it make these politicians scared of the election consequences. What happens if they don't
Yes.
support universal health care?
Right. I think one of the things that explains the Trump phenomenon
Mm-hmm.
is the lack of real progress in terms of
Mm-hmm.
democratic demands
Yeah.
that would change. So as people's economic conditions continue to worsen and
Mm-hmm.
healthcare wasn't solved by the Affordable Care Act,
No.
uh, democracy, to be real, has to include the betterment of the lives of
Mm-hmm.
people. It's hollow
Yeah.
if our
Mm-hmm.
vote doesn't really determine those conditions. it's only we have formal elections, but actually what you say doesn't go. It's really the corporate companies that are running the country, right? Well,
Yeah,
that
we haven't
can
really
only stay
had.
so long, right?
Yeah, we haven't really had actual. I don't think we've ever had actual democracy in this country. Like even when we had the New Deal, that came about from sustained, organized working class support for these ideas because they were scared that if they didn't provide these ideas, that the consequence could have been a socialist revolution at the time. And so we had to sustain push that off by giving the the New Deal and not universal healthcare, but Medicaid and Social Security, Medicare, and all of that at the time. And I think ever since the 90s, Kentucky used to vote blue pretty much every election since the New Deal until like 96. And that was because of NAFTA and the abandonment of the coal mining industry here. And they blamed Bill Clinton for it, and rightfully so. And so people have always been upset about it. And the Democrats became a party of not the working class, but of a party of corporate interests, like the Republicans a bit. And so, it's this idea of like an actual democracy for working people has kind of always been a bit of more of a sham than people like to admit. I don't see representation, like representatives of myself and my politics, that often in politics or in Congress. There is not a lot of those people, and it's not because we're like we've been talking about. It's not because these ideas are unpopular. They're very popular. It's just they make it really hard for people like us to be able to get into places of power or to build actual power. And they try really hard to make sure we can't do that, and also go on the defensive against us to stop us from doing so.
Yeah, well, the only thing that politicians need more than campaign money is votes.
That's true. That's true.
And that's where the possibilities and the challenge come in. I mean, can we make democracy more real by bringing to bear the real needs of people to actually legislate to improve the economic conditions and the healthcare of the people of the nation? And, that really is our hope. I mean, we have to do that in order to sustain any kind of a democracy, any kind of ability to have a decent life in this country. So we see healthcare as maybe the way that we can start.
Like this is like the main priority of like a working class movement in this country should be getting universal healthcare. It should be one of the top priorities. It might be universal healthcare might be the most number one important issue for this country to be like to become like a better place for people.
Well, I think it's a real possibility that it can be on the agenda in the very near future, because the crisis now, it's not just the poor. It's the entire working class people, and even many, many, many people who have been a little bit better off were hit by these, the end of the subsidies, the enhanced subsidies. And that's causing their monthly bill for health insurance to go into the thousands of dollars, which who can pay that?
I do think things are less bleak than they were maybe 30 years ago when it comes to these ideas. I do think with the rise of like Bernie Sanders running in 2016 and 2020, and also Zohran Mamdani being elected in New York, and a recent poll showing that 45% of Democrats call themselves democratic socialists. I don't know if that rather means that they, believe in the social democratic ideas of Bernie Sanders and AOC, or if they believe in, more left-wing socialist policies or whatever. But it's still showing that these ideas are becoming more and more popular, and people are wanting these policies, and that I think it'll be very, very hard for someone in 2028 to win on not running on some sort of universal healthcare program. I don't think it'll be possible for these people to win the Democratic Party vote.
Well,
Um,
we have to try to make them do that. I keep
yeah.
looking at, I've looked at the primary election in 2016 in Kentucky,
Hmm.
and it's amazing that all of Appalachia went for Bernie Sanders
Yeah.
in 2016, and all the rural areas did
Yeah.
as well. And
Yeah.
uh, so if you look at the map of the Trump victory, those are the areas that Trump won.
Yeah.
So it's that economic message, and of which improved Medicare for all, healthcare coverage for everyone, uh,
Yeah.
I think is the agenda that we need to get Democrats, Republicans, Independents, Greens, and whoever else is out there
Hmm.
to make a part of their agenda. And that's what we're out to do. You got any
Hmm.
advice for how we win these issues among the people in Appalachia?
And I would say to join DSA, but I would also say, if you don't have, especially in Eastern Kentucky, I know that the organizing ability there is a lot more difficult because of how sparse and spread out people are. But you can organize wherever. Like this is there is you can reach out if to at-large positions in some Democratic organizations. You can post online about things. You can write about things. You can talk to your coworkers and your workplace about possibly forming a union and building that working class power in that area. And then getting more involved in your union to push for universal health care coverage as a part of your union's agenda. Um, I think that we are in a better time than we've for organizing around these ideas than we've been probably about 60 years. And so I think we can win. I think we will win. I know we will win. So
You've been listening to Single Payer Radio. It's brought to you by Kentuckians for Single Payer Healthcare. And our guest is Dare Cima, and she is from the Appalachian region, was raised in the region around Corbin and Barberville, and had much to say about the healthcare of the region and things that she has learned from her deep roots within the working class of Kentucky's Appalachia. So thank you so much, dear, for being with us for this.
yeah,
If
thank you for having me, Kai.
if you have anything final, we'd be glad to let you say it, but we are pleased to have you on the show, and we'd like to work with you about reaching out to our sisters and brothers in that area of the state in the effort to build a movement, invincible movement that
Mm-hmm.
will that will pass and improve Medicare for all. So anyone who wants to get in touch with us, you can see us at kyhealthcare.org, and we'd be glad to talk to you, or we have an email that you can reach there. And we thank you for listening.
Thank you, Kay, and special guest Dare Cima for today's program. And thank you, listeners, for joining us. You've been listening to Forward Radio, broadcasting from Louisville, Kentucky. Visit the station at forwardradio.org. This is Paul Hoppy, wishing you a wonderful rest of your day.